Thanks, that was long. I just want to say I'm a hard-working doctor. Thanks for letting me be here. As Eric said, I've worked at La Hacienda full-time and now also with All Saints Recovery in Plano. I was a Southern Baptist missionary kid, born and raised in Tanzania. Graduated from high school out there, married a girl that I met when I was 4 years old when her parents also came out to the mission field, and now 6 kids, and 44 years later and 20 grandkids. I have a busy, crazy life. But yeah, it's a blessing. So hey, but what I want to talk about today is, it's always funny when you're speaking to treatment sort of professionals about, are you already preaching to the choir? I mean, what sort of that kind of concept, right? But sort of information I think sometimes that might be a little overlooked. Really loved your comments, and I make a big deal for me as a doc about the concept of that people can be recovered, but recovered and cured are different words, and the concept of physical fitness, you can be fit and not getting in shape, but guys that I love and admire like Cade, if I say, are you recovering? Are you sick and ill and recovering? And he'd be like, I'm a grateful, recovered addict, alcoholic, right, through God's grace. And so sort of the concept, though, of just what I share kind of with patients and with families, and then in this particular environment also getting to go a little bit deeper on some of the spiritual aspects that I think are so integral to sort of human existence. So I want to start off and talk a little bit. We're going to talk about neurobiology, and sometimes this talk don't get lost in some of the details. I'll try and make it completely appropriate. So if you look at this sort of schemata of the brain, right, you can see that outside rim. That outside portion is the cortex, and that's where all high-level function happens. My ability to read, to write, to throw a football, balance, coordination, vision, hearing, all the cool human stuff that we can do, right? And that outside part, there's also nothing key for survival in that part of the brain. So stroke or tumor, all of those things would be resectable. People wouldn't die from that unless there's massive swelling, bleeding. But then we get into the midbrain, so you can see sort of where those memory pathways, but that, where the yellow is sort of around it, and then right there in the middle, that middle part of the brain, or the midbrain, that's where those key survival structures live. So that's where my fundamental drivers, my breathing is controlled, my blood pressure is controlled, my heart rate is controlled, my temperature is controlled, right? I trained at Baylor in Dallas, and I remember my third-year residency, we had a lady come into the Baylor emergency room, temperature's 114 degrees shortly before she died. Septic workup was negative, and she had a tiny stroke right in her thermoregulatory center and died this hyperthermic death, right? The key things that keep me alive. But then there in the reward pathway, that's where addiction lives, right? It's in this very fundamental, deep-seated area, as opposed to sort of that cognitive high-level function. And to me, that's important, right? So if I made Eric a bet, I'm like, hey, 2 years to train Eric. You live in Galveston by the ocean. Hold your breath for 5 minutes and 15 seconds. I'll give you $10 million 2 years from today, right? And if Eric is like, holy moly, right? So if he Googles it and breath holding techniques and records and stuff, 5 minutes, people go way longer than that. But over the age of 30, Eric, it's not going to happen. But if on test day, right, he's like, okay, I'm going to do it. I'm not going to breathe, right? Then what will happen? He'll pass out and he'll breathe. He doesn't die. But that survival part of the brain, right, can supersede cortical function, can be drivers, and just the concept of where that lives, right? And you guys are all familiar with the mouse study, and for me that was actually really profound, but on 3 different levels. So those of you, just kind of a brief reminder, right? You put a mouse in a cage, you put an animal in an enclosure, and animals explore perimeters. So leave the gate open in your backyard, your dog's gone, right? I mean, he finds the opening. They explore perimeters. So they just put a little bar on one side that was low enough and wide enough the mouse doesn't jump it. And every time he walks around, he steps on that. And every time he steps on that, that mouse gets intravenous, whatever I put in that bag. And if you put blood pressure medicines, diabetic medicines, antibiotics, the mouse doesn't care. But if I put alcohol in that, the mouse acts like a lot of my patients and your clients, and he just hangs out the bar all the time, right? And gets drunk, gets a snack, runs back to the bar, and they stay drunk all the time. You put drugs like meth or cocaine, they quit eating and drinking, and they die stimulating that. They don't walk 18 inches, the most powerful survival instinct that we know in the animal kingdom of thirst and food, right? It supersedes the survival instinct. So when that study was presented, it really kind of was hallmark in addiction medicine, and the concept that, hey, these drugs are addictive, these drugs are not. Prozac, no worries, no problems, no issues, right? Melatonin, no problems, no issues. Put Klonopin or Ambien in there, the mouse loves it, right? So it allowed us as addiction treatment professionals to go, hey, this is a bad choice. Let's find other things. And then the concept of sort of the severity of addiction also brought to mind. But for me, when I first heard that data presented, probably the most profound part on that to me was that it superseded the moral equation. I grew up with a very fundamental sort of belief in right and wrong, and my concept around addiction was, hey, do the right thing. And for 20 years, I joined my family's practice in Houston. In the late 1990s, early 2000, we had 25,000 active patient charts. I worked in that practice for 14 years, and in 14 years, I didn't send a single person to treatment, a single person to a chemical dependency counselor, a single person to an AA meeting or an NA meeting. Super well-trained, Southwestern, AOA, Baylor Internal Medicine, told people to stop. These are all the health concerns. And then when my brother called me and said he was at La Hacienda and he'd love me to come, I'm like, what do you do? It's like, I work with people with addiction and alcohol. I'm like, oh, Dan, those people are terrible. Like, well, that's got to be the worst job ever. He goes, no, it's not what you think, right? And he convinced me to go out. And that's where sort of that transition of looking at things from a disease model of addiction, right? And to sort of, again, segue off the gentleman's statement in the back of this is what you have, this is not what you are, right? This is what you have. And what a radical thought that is, as opposed to this is who you are. So from a training standpoint, I just saw people who are active in their addiction, and I'm like, they're trying to get prescription, and they're saying they lost their script, and they're doing this, and I'm sewing them up in the emergency room, and they're obnoxious and intoxicated. And I'm like, no, that's what they have. And then I come and I see people pursuing recovery, and I see these delightful, smart, talented humans, and I'm like, oh my gosh, this is who you are, and that's what you have, right? And so that thing of going, this separates from the moral equation, because nobody's telling this mouse to go to mouse church, right? I mean, it's like something is different, right? So sort of that deal of what's going on. And just for a heartbeat, when this study came out, there was a big kickback, and people said, hey, but this study is invalid because you've taken the mouse out of a community, out of the social network. And so this study called the Rat Park study, most of you are probably familiar with that, but basically if you put mice in big boxes with lots of little mouse friends, male and female mice, and lots of little food treats and little toys and little things, then actually most of the mice don't choose drug. About 15% of the mice choose drug, 85% don't. And so the Rat Park people are like, no, this study is fundamentally flawed. The problem is all the social construct. And it's not the whole concept of addiction this is all about the social construct. And I think both these studies are flawed. So in the AA community, and what you guys have been talking about already, is that you cannot do this by yourself. You can't do this alone. You need help. You need peers. You can't do this by yourself 100%, right? But then the flip part of that I think this study is also fundamentally flawed, is that we don't live in Little Mouse Disney World. And we have breast cancer, and we have colon cancer, and we have car wrecks, and we have deaths. And I talk to my patients, I'm like, when I have somebody that relapses over the death of a parent, the guy that's lost both my parents, I'm like, hey, when life is perfect, we get to bury our parents. And when it's hard, we bury our kids. And if your emotional stability hinges on the absence of stressors, we're done, right? At this point in time, we're in a broken world and a broken planet, and there will be redemption at some point, but it is not here. And right now, we live in a broken planet, and how do I build up that resilience? But just from the concept of the Rat Park study. The only thing I just want to sort of mention here briefly kind of segues off too in that identification. And not to go over the details, but I talk in this slide just a little bit about the concept of the reward deficiency syndrome. Some of you might be familiar with that phrase, some of you might not, but one of our leading researchers, this guy named Blum, talked about a long time ago, and I really thought, when I first started working at La Hacienda in 2002, if you had told me, hey, do you think they're still going to use the word addict alcoholic in 2026? I'd be like, I don't think so. I think they're going to change it. I think they might say, like, you have the reward deficiency syndrome. Because genuinely, right, it's a description where Blum talks about that persons with addiction, so we know that genetics play a role, and that also is fascinating to me. For me as a physician and also as a Christian guy, just that concept that sort of genetic predilection, but in a broken world, you may have genetics for breast cancer and you've got the BRCA gene, you need a prophylactic mastectomy, or you've got a strong family history of major depressive disorder, and we know that that increases your risk dramatically just from a genetic, or type 2 diabetes. And so the concept, and they did adoption studies to show that increases your risk by about 40% with one parent, right? But then major trauma during childhood and adolescence that some other speakers have talked about, that brain changes, that we're not built for that, right? That's not God's design for that horrific sort of circumstance to happen in a developing brain. But either of those things, sort of that genetic risk factor and or major trauma, neurological changes, so my reward pathway where I experience pleasure and the key things that keep me alive from a food standpoint, right? Chick-fil-A nuggets, I mean, how good are those things, right? So, but those things that we like, oh my gosh, that's so good, and if I don't eat, I die. Number one cause of death in the history of mankind is malnutrition and starvation. We're built for that, right? For hunger. Peak naturalist sex, 150% increases in dopamine, but if there's no procreation, the species is dead in one generation, and God said, be fruitful, right? And we're built this kind of thing, the way this God's design, but with a broken planet, broken humans, we have stuff. And that person that's got a reward deficiency syndrome, the first time they get their hydrocodone prescription when they have their dental work, and all of a sudden they feel better. And they're like, oh my gosh, I wonder if this is how normal people feel. Focus, energy. I feel different. I don't have that at all. None. Not one whit. I tell a story when I'm teaching about a kid. I was in practice in Waxahachie, Texas, and I had this young kid, this little at Southwest Assembly of God College there in Waxahachie, that screws up his knee and comes in to see me. I give him a prescription for Vicodin, no orthopedist in town back in that year full time, and get an MRI on his knee. He comes back to see me that next week. I'm like, hey, you got a bad tear. He goes, hey, Dr. Boone, I feel great when I take those pills. I'm like, really? Like, what do you mean? He goes, I don't know. So weird. Did great on my tests, more energy, more focus. I thought he had the wrong prescription. I'm like, hey, did you get somebody? Let me see your bottle. I'm like, it has his name on it, Vicodin. I'm like, this sounds like Adderall or Ritalin. And then I open the bottle, and I'm looking at him, and they go, these? And he goes, yeah, can I get more of those? I'm like, no, right? Not knowing what I was doing. 18 years later, I start training in addiction medicine. 100% of my opiate patients, 100% of them are like, doesn't everybody feel that way? I'm like, no. I don't get one whit of that. Not because of anything, that I just don't have it, right? Now, the beauty is that recovery can happen. So on the reward deficiency syndrome, right, we can see it play out with substances. You can see it play out with non-substances that stimulate the reward pathway, right? You can see these other behavior issues and some of the other neurodivergent traits that really probably kind of link back from a reward deficiency syndrome. Now, the next big person that was really profound, and it's really interesting if you look at sort of the concept of behavior and good decision making and all that stuff, has to do with our prefrontal cortex. And most of you in this audience know that. And I do want to sort of focus on several of these things. So in that little schematic on the brain, all of those structures in green, all of those things make up different parts of the prefrontal cortex. And so just because I don't want you to get lost in the nomenclature, but that ACC is angular cingulate cortex, dorsolateral, mediolateral, prefrontal, olfactory frontal. But all of those structures, prefrontal cortex, right? That's what gives me impulse control, judgment, and reasoning. So my ability to go, hey, I really want to do gosh, I probably need to. Every one of us today probably did something where you're like, gosh, I'd love to, gosh, shoot, I need to do. So anytime you have that executive functioning, that ability to inhibit something, that ability to have reasoning, all of that comes from our prefrontal cortex. And if you look at sort of the prefrontal cortex, and this is just a little bit of some of the neurobiology around sort of addiction itself, but we can see that here's a study, again, most of these studies are 2010, 2014, when we started getting the ability with functional MRI and positron emission tomography to actually see what's going on in the brain, right? And so you can see structurally and functionally impaired in addiction in that dorsolateral prefrontal cortex. So it's pretty fascinating. If you look at the bottom thing, people who are actively drinking, if you do volumetric MRIs, that prefrontal cortex can be 20% smaller than the general population. 20% smaller. So it's one of those things for me, because the behaviors that you see when your folks you're working with are active in addiction, right, they do things that their family's like, what the heck? This doesn't make, like, what are you doing? You're going to risk your marriage for a hydrocodone tablet. You're going to give up relationship with your kids for a bottle of wine. What's more important? And there's tears and there's promises and broken promises, and they do it again, right? But that thing, if I look at that and go, I wouldn't look at a stroke patient and go, why are you limping? Like, straighten up and stop doing that with your arm. And I mean, you'd be like, oh my gosh, you're hemiparetic, you've had a stroke, right? What is my expectation? And that concept for me to look at people in that early stages, right? Early recovery, when you're looking at them, and if I look and go, the part of your brain that gives you the ability to have normal impulse control, judgment, and reasoning is depressed. Medial olfactory frontal cortex, angular cingulate cortex associated with the craving phenomenon, response to the reward, right? Just that thing from a prefrontal cortical standpoint, that's the part of my brain that is damaged and what the part that works. This is pretty fascinating. Dorsolateral prefrontal cortex with addiction is hyperactive during emotional processing of negative emotions. That thing, when people are active in addiction, that ability to have wisdom, judgment of going, hey, this is really pretty small, right? But all of a sudden, it's hyperactive as they process negative emotions, right? And you see them focus on the negatives, focus on the guilt and shame, focus on the brokenness, and then further reduce sensitivity to negative reinforcers, that concept that adverse consequences don't change behavior when you're active in addiction. Which again, if I'm a family member that doesn't understand that, I'm like, do you not love us? Like if you did, you would do something. You wouldn't do that again. And yet that ability, right, that ability is impaired. And then lastly, even insight into the illness. Some of our counselors will do timelines with patients, with our clients. And when I usually get their histories, I kind of do it chronologically. And sometimes when the people are saying everything out loud, and then I was, and then I lost, and then there was this consequence, and then there was this, and they say it all out loud in a period of 20 or 30, and it's kind of like, sounds pretty jacked up, doesn't it? I'm like, yeah, kind of, right? But even the ability when you're in it, right, to not have insight, it comes from the prefrontal cortex. It's kind of interesting. Right before I got here at All Saints, they had a speaker talking about executive functioning. And for those of us who are at this lecture, this is a fascinating talk, and it was sort of random. But when I was thinking about this and reading about this a few years ago, I'm sort of like, I wonder, when you really look at prefrontal cortex, it's like, it sounds like that's where wisdom is, right? Like, and how do you define wisdom? We've all known people, you're like, she's so wise, and commonly it's older folks for me, people that have had a lot of experience to kind of process. But so I go through PubMed, and there's this fascinating review article by these two guys, Meeks and Jost. And The review article is on the neurobiology of wisdom, and they define wisdom by these 6 things. They had to go through multiple cultures and continents and sort of try to define, like, what is it? Because every group, every tribe kind of knows wisdom when they see it, but it's like, how do you define it? I don't even know if I would have known how to even answer that. But this is what he came up with. Number 1, pro-social attitudes and behavior. Not pro-social like happy hour is my favorite thing, but pro-social is in, I care about my social construct, right? My tribe, my people, that thing. Social decision makings. My decision is not self-interest based. I think about my social construct. Emotional homeostasis. Just this calmness, that ability to just sort of ride with the thing, go through the flow. There's something bigger, right? This is not the biggest thing. This will pass. That concept, right? Reflection, self-understanding, value, relativism, and tolerance, right? Just like, yeah, we see things differently. Like, it's crazy even saying now, but like, hey, we voted for different people, but you know what? We really like each other. And 90% of what we love and think is true and real is the same. And we differ on 10%, not 90%. Let's write that thing, value, relativism, and tolerance. Acknowledgement of and dealing effectively with uncertainty and ambiguity, right? I didn't make this up. This is just from this Meeks and Jost review article. But when I was reading this, and I was thinking about patients when I admit them into the program, patients, think about your clients, think about people who are active in their addiction, and look at these things. It's like the polar opposite. It's like the exact opposite. Consume with sort of self, right? Consume with guilt and shame. Complete lack of emotional homeostasis. Intolerance of anything. Uncertainty is going to destroy me. I don't know. I'm not in right. It was just fascinating looking at. It's just a complete difference. And so then he goes on to define sort of where does wisdom come from, and healthy prefrontal cortical activity, especially the dorsolateral prefrontal cortex, emotional regulation, decision-making, top-down regulation. That's my part of my brain. If I'm active in addiction, that's 20% smaller than the general population. When you're active, recovery happens. Brain recovery, structural integrity returns with healthy recovery and sobriety. But early on, right, in that active thing, lateral prefrontal cortex, calculated reason-based decision-making, prefrontal cortex, emotional valence, right? I mean, that thing where they start looking at it and they're going, hey, it's about the prefrontal cortex. Sort of a random quote from Martin Rotek. Some of you may have read that, but we begin to realize that it will take something more powerful than we are to relieve our suffering. This is what we've been missing all along, a source of hope. Right? Could the spiritual foundation of 12-step recovery actually improve our atrophic and poorly functional prefrontal cortex? So the problem is when our patients get here, when they first meet you, their prefrontal cortex looks like that view on the side. I think that is the same human. I've kind of looked at the tattoo on the biceps, right? But the concept, can we change, just like we change our body, right? And with that, I just put up this Bible verse from Genesis 1:27, right? So God created mankind in his own image. In the image of God, he created them. Male and female, he created them. When patients come to me and like, I'm a very spiritual person, I'm like, yes, you are. Yes, you're created in the image of God. You've never met a human that is not a spiritual person. We are created in God's image. And in fact, if this big spiritual part of how we're created, if that's not addressed, we're not whole, right? So from a spiritual standpoint, it's no surprise that potentially there's some things that happen when we address that. Now, one thing that I just kind of threw this in, because sometimes when I give in this lecture, and I've talked a little bit about the genetics, and I've talked about sort of the disease concept, and people who are in recovery that have children are kind of hyperventilating on the concept that it's about a 40% risk that their child may struggle with that. But then I kind of love to look at the concept of addiction of about epigenetics, right? You can't change your genetics, but you start changing how you live your life, you physically start to change the structure around your chromosomes. You start to change your epigenetics. You can then pass down, if you have new children after your recovery, they get your genetics, but they get your epigenetics. And then they pass down their epigenetics, right? The concept, right? The concept of the sins of the father go down to the third generation. But do y'all know the second half of that verse? But the blessings go down 1,000, right? 3 with brokenness, 1,000 with blessing, right? The concept that you then, as you live this spiritually controlled life, and the kids that you had when you were still active in your addiction, now they're seeing and developing their own epigenetics from a spiritual wellness that are going to give them resilience. This verse out of Romans, the creation itself will be set free from its enslavement to decay and will obtain the freedom of the glory of the children of God. We know that the whole creation has been groaning as it suffers together the pains of labor. My probably biggest misconception, which I've already talked about, was just that concept that this was just a moral failing. This is just, and I feel like, in general, from a church standpoint, and I can't tell you how I want people to be involved in a church body and be involved in a Bible study and be involved in the fellowship, but we haven't done a very good job as far as people willing to truly be open about their brokenness, right? Christians get diabetes and they need insulin, and Christians get breast cancer and they need a surgeon, and they need chemotherapy, and Christians have major depression and they need Prozac. Right? And they also need counseling, and they need that thing, but we're a broken world, and we're a broken planet. And Jesus says, I am the way, the truth, and the life, and that truth means everything, right? That truth means history, and it means insulin, and it means penicillin, and all those things. Every good thing comes from above. And for us that are in this world, right, what you have to offer on trauma counseling and doing additional work, I mean, all of that is a part of what we do. Just a few studies, kind of looking at just sort of the things. This study, when I teach on this slide, I think this study was a little bit flawed, but it's fascinating because it comes out of Columbia University, an older study back from 2001. But the thing that's fascinating to me, so for me as an addiction medicine doc, like with alcohol, naltrexone, which improves relapse rate by about 30%, an FDA-approved medication, a Camprosate or Camprol, about 30% improvement, FDA-approved medication. And so we get 30% improvement. Adults who did not consider religious beliefs important were more than 150%, right? 1.5 times more likely to use alcohol and cigarettes, 2 times more likely to binge drink, 4 times more likely to use illicit drugs other than marijuana, 600% more likely to use marijuana than adults. Now, the reason I think this study is a little flawed because you bring in some different kind of moral guidelines, some different things that potentially could be sort of more guilt and shame and transiently based as opposed to a lifetime heart change. But at the same point in time, the numbers are pretty dramatic. If I can get a drug through the FDA approval process that improves success by 30%, right? Even a study from 2001 that shows me 400% and 600% is interesting. This study is interesting for me as a kind of a guy that reads studies. And number one is that the retention rate on this study is pretty amazing. So they had 2,966 patients that they followed for a year. They retained 2,947 of those patients for the retention of the study. It's pretty unheard of, honestly. 5 different measures of spirituality, including strength of religious beliefs, frequency of attending religious services, religious books, programs, frequency of prayer and meditation. So those are the 5 different kind of areas, right? Percentage who achieved remission rises significantly as spirituality rises across all 5 measures. And a p-value of less than 0.0005, if you remember back to your old statistics classes, better than 0.01, right, is significant. Those who attended religious services more than 1 time a week, 16% higher remission rates. Just that thing of like, there's something there, right? If you look at just the neurobiology of successful abstinence, what happens to your brain with abstinence? So in gray matter volume, when I teach with my patients, I'll tell them, we usually have like 70 or 80 patients inpatient at La Hacienda that I teach twice a week. And I look at them and I'm going, hey, I always got like 20% of those people that are so smart, just like freaky smart people, right? But I'm like, hey, I can be like the annoying junior high guy and go, yeah, but my prefrontal cortex is bigger than yours, right? Like, genuinely, if I do volumetric MRI on every patient I've ever admitted to La Hacienda on the day of admission and do mine, that brain, that prefrontal cortex is more vibrant, more active, and bigger. Now, the cool thing is, I'm not making that bet with anybody even a month after they get there, right? So within 30 days, we start to see recovery in volume. You can see continued recovery. You can see continued recovery in size out to about 9 months. This elevated blood flow, elevated frontal lobe blood flow. So when I got my knees replaced a few years ago, I could feel my distal femurs, my distal thigh, and it was hotter to touch for about 6 months. I could feel my thigh get down low. And why was that? Because my body is dilating blood vessels, healing implant site. Get a bunch of round of smoke in the fire, bad allergies, and your eyes are red because your body's vasodilating, right? My best friend sent a picture of his dad's arm with a terrible cellulitis. I tell him, you got to get that guy to the hospital just this morning. That arm fiery red. Why? Because the body is dilating blood, trying to get white blood cells, oxygen to that infected site. So we can see, right, elevated frontal lobe blood flow up to 4 years in recovery. You know what that means? That means your brain is getting better. Like 6 months from now, I tell my patients, hey, 6 months from now, you're going to be better. A year, you're going to be better. 2 years, you're going to be better. 3 years, you're going to be better. And you're pretty good at the 30-day mark. You're already laughing. You're making good choices on what you're going to do next, but it's going to get better, right? That concept, and from a hope standpoint, not that, oh my gosh, I got 4 years. I'm like, yeah, but you're already made so much progress. It's unbelievable. And there's going to be continued healing. So more than just recovery, right? Because it's the ability to maintain recovery. It's like if I had a stroke patient and I knew I could actually generate new neural cells, if I could grow those pathways that have been damaged, right? I'm doing more than just physical therapy, trying to recruit muscles that are kind of coming back and trying to take over. What if there could actually be something different that takes place, right? It's incredibly hopeful for me. Higher power. I'm a huge 12-step recovery fan. I love it. I personally, my story is strange. I didn't get into recovery from family involved, from personal involvement, from personal struggles. It was complete sort of random God's guidance. My brother had moved to Kerrville, wanted to live in the hill country. His best friend used to be the chief of operations, recruited my brother, who also no addiction, to come work with them. And then Dan recruited me 2 years later. And for me as a Christian guy, the concept of 12-step recovery to me is so fundamental. It's so beautifully written and so basic and non-threatening to so many people who have been wounded by the church. But it is skeletal. It is framework. It doesn't have any flesh on it. It is still skeletal, right? But if I can take people who are completely self-driven and I can move them into a realm of theism, of something bigger, and have them continue to seek, and my concept of like, hey, just keep looking, seek and ye shall find, right? Can I be body of Christ and somehow demonstrate those fruits of the Spirit that are then attractive, right? Of love, joy, peace, patience, kindness, goodness, gentleness, faithfulness, and self-control. Like, who doesn't want that stuff, right? And so for me, from a higher power standpoint, I love to be able to take people even just to that basic thing of that you're not in control. And this cognitive dissonance, right, that it's got kind of been a popular catchphrase, right? But I mean, Because people with addiction struggle. They're like, no. When I put my mind to something, like I can freaking do, I did, and they tell some business principle, they tell some workout thing, like, no, but I'm like, yeah, but in this area, you can't. You continue to fail, and you keep trying to do it, right, on your own, as opposed to going, hey, there's something different, all right? That result is cognitive dissonance, accepting powerlessness, and calling on a higher power to guide and govern. Process played out in the anterior cingulate, another prefrontal cortical structure. When I started working there, I was telling patients, like, man, I'm doing the same. This 12-step thing is like, I think about it in my own life. I'm like, well, Dr. Boone, what do you not have control over? I'm like, life, right? I mean, I have patients that are like control. I'm like, you're like on that little ride at Six Flags that I passed that have such fun memories of the little car. You can only go this far and so slow and so fast, right? And look, that we're created in God's image. We have the ability to choose, but at the same point in time, right? I'm telling you, you're not in control. If you think you're in control, you're going to get old, wrinkled, and die. How's that for control, right? That concept of me losing that is not then, said with sadness, but it's with joy. I don't have to drive the bus, right? My job is to do two things. Love the Lord your God with all your heart, soul, and mind. Love your neighbor as yourself. That's all I can do. And I'm going to do that, and I'm going to leave that into something bigger, lose cognitive dissonance out of my life. The fellowship of 12-step recovery, the fellowship of a community of people who are believers, the fellowship of community of people who are fighting the same sort of thing, the fellowship in AA, right? There are these things called mirror neurons. A lot of y'all are probably familiar with mirror neurons, but it's really funny if you're not. When you're around people, especially if you sort of like them or whatever, you start mimicking their expressions. You start talking like them, but it's even little things. It's subconscious. So it happens to me every day in the office. I'm sitting there talking to a patient, and she's across the desk from me, and she folds her arms and leans back, and then I fold my arms and lean back. It's yawning is sort of the classic thing with people, right? And I'm like, dude, shoot, I did it again. And then sometimes I'll play with them. I'm like, how's it going today? I'm like, it's going okay, Dr. Boone. Thanks for asking, right? I mean, just the concept of mirror neurons. But for me, right, it's that thing of if all of a sudden you're in the herd, you're surrounding yourself with like-minded people, being around, even our bodies in general, we start to reflect that. Mentalizing, the ability to understand one's own mental state and its relation to another person, to see them separate from their behaviors. So we have Texas A&M medical students and University Incarnate Word medical students train with us, and it's one of the things I really stress with the medical students because it was my struggle, and I'm like, hey, the most important thing I want you to see hanging out with these people who are in recovery and who are choosing recovery and are pursuing that, you're going to see like, oh my gosh, they're great. It's not who I thought. I thought it was going to be like, I don't know what I thought, right? I'm like, right, because they are not their illness. You have seen them only active, and as opposed to who you are, this grateful, right? As Paul said, sinner saved by grace, grateful, recovered alcoholic, right? Hebrews 10, 24 through 25, let us consider how to stir up one another to love and good works, not neglecting to meet together as is the habit of some, but encouraging one, and all the more as you see the day drawing near. Adverse medical effects of anger. So, it's kind of funny. From a biblical standpoint, the concept when people talk about Christianity and rules, like, I don't like all the rules. I'm like, there's no rules. So my point on this, let me just give you so if you got a new phone today and you've got the instruction manual, it's like, do not take a bath with your phone, right? You'd be like, I hate that rule. You'd be like, no, it will break, right? Don't plug your phone into a 220 outlet if it's a 110 phone from the US when you travel overseas. Like, it will blow up. Do not use it to hammer nails. It's not built for that, right? You would not go, there's a bunch of rules on this thing, right? You'd be like, oh yeah, the instruction manual. I drive this Ram diesel truck. Diesel's like $100 a gallon right now. I'm like, hey, it's my truck. I'm gonna put gas in it. It's cheaper. Like, no, it's not built for gas. It will break, right? And the point on that is just from an anger standpoint. If we look at anger, blood pressure and heart rate increases, sympathetic overdrive, risk of hypertension, cardiovascular disease, cortisol release, immune suppression and inflammation, sleep disturbances, metabolic dysfunction, chronic anger linked to shorter lifespan, right? Hyperactivation of the amygdala, heightened threat response, reduced prefrontal cortical regulation, poor impulse control, increased dopamine, norepinephrine, increased arousal, agitation, chronic anger, hippocampal function, memory impairment, neuroinflammation linked to mood and cognitive decline, right? And that thing where God goes, yeah, it's okay to be angry, but do not sin. Do not let the sun go down on your anger and give no opportunity to the dark side, right? That thing of me going, it's not a rule. It's like God's like, no, I built you. I designed you. I built you. It's bad for you. Like, this is bad. It's not because these are the rules to be a good person. It's like, I built you. I designed you, right? There's something that you need to work on. Forgiveness. Forgiveness in the brain. The amygdala activity decreases, reducing threat detection, emotional reactivity. The prefrontal cortex, which is what's impaired, right, supports rational decision-making and empathy. Angular cingulate cortex resolves internal conflict, regulates emotional processes. Temporoparietal junction facilitates perspective taking and understanding others. That concept, right, of residual anger and its effects when you forgive, reduces cortisol, stress hormone, activates reward circuits. It actually feels rewarding. Strengthens empathy networks through repeated practice, reinforcing compassionate responses. Promotes neuroplasticity, helping to rewire the brain pathways over time for better emotional regulation. That thing that God takes this pretty importantly, right? He's like, hey, bear with one another. If one has complained against another, forgiving each other as the Lord has forgiven you, you must also forgive. And again, it's not a rule. This is like, it's so bad for you. Like, you have freedom if you will go through that process, and there's neuroscience behind what happens. The first time I sort of saw some neuroscience behind some of the biblical concepts, I was in practice in Pasadena doing general internal medicine. I'm an internal medicine doc before I went into addiction medicine. And New England Journal of Medicine, one of the biggest sort of peer-reviewed internal medicine journals, most well-known medical journal, had this brief article on going to bed angry and what it did to arterial wall thickening in your carotid arteries, the further increase in stroke, of these minor changes in stress hormones and increased intimal thickening. And the end of the article was like, it turns out that it really is bad to go to bed angry. And I was like, I think somebody said that a couple of thousand years ago. This thing that so often is said in so many 12-step meetings, right? Our Father in heaven, hallowed be your name, your kingdom come, your will be done on earth as in heaven. Give us today our daily bread. Forgive us our debts as we also have forgiven our debtors. And lead us not into temptation, but deliver us from the evil one. This forgiveness is the deal that is, again, it's not an option. Not an option as in this rule that you're condemned if you don't. But God goes, I came that you may have life and life to the full, right? That if you're living with unforgiveness, it's so bad for you. And God's just like my kids. Like, I want you to have joy and peace and contentment in your life. In the 12-step community, stories of self-disclosure are strongly associated with increased activation in the mesolimbic dopaminergic systems. When we talk about ourselves and we tell our story, it's actually sensed as a reward. We like it as humans. But fascinating sort of study from Dunlop, narratives of self-redemption, shared strength and hope, are predictive of change and improved health. 2 studies revealing a common difference in the narratives of long-term sobriety compared with short-term. 83% success compared to 44% success with redemptive versus non-redemptive. Strength and hope as opposed to war stories changes your brain, changes other people, again, what God calls us to do. These verses, James 5:16, therefore confess your sins one to another, pray for one another that you may be healed. This is out of the Message 5:24. This is how I want you to conduct yourself in these matters. If you enter in your place of worship and are about to make an offering, you suddenly remember a grudge a friend has against you, abandon your offering, leave immediately, go to this friend and make things right. Then and only then come back and work things out with God, right? This concept of forgiveness, that God wants us to be in that place. When we talk to one another, confess your sins, speaking out loud one to another. The 12-step community, the camaraderie that exists in the healthy recovery community, gosh, it's beautiful. Healthy recovery, I commonly see it better than a lot of my churches that I've been a member of in the past. And that's something that I think is a beautiful thing. The spoken word, when you actually do a fifth step, right, reaches our memory through a different pathway, creates new memories via the amygdala, the hippocampus. Step 4, followed by the fifth step, doesn't focus on the chemical, because what you actually have is the reward deficiency syndrome, right? You're focusing on these things that come from that, making amends, helping others as a form of altruism, improves the synthesis and release of oxytocin, the human bonding neuropeptide. It's almost like we were designed, right, by something bigger, that something bigger that wants a life of joy and peace and contentment. Famous psychiatrist Carl Jung, in his letter to Bill Wilson, you see, alcohol in Latin is spiritus, and you use the same word for the highest religious experience as well as for the most depraving poison. The helpful formula, therefore, is spiritus contra spiritum, right? What this spiritual care network is about is that the recognition that we are spiritual beings, and that if you pursue those things, it changes us, and it changes us for the good. And there's science behind that, which is no surprise. We're just now catching up with our ability to see how we're actually rewarded for following through and doing what God designed us to do. So that's all I have, and I'm happy to answer any questions. I've got three and a half minutes here, I think. But happy to answer any questions if anybody has any questions. I think the room's small enough. If you just speak out loud, I can probably hear you, since we don't have the box to throw at you. Anybody? Well, yeah, I just that for me, the thing that I love about good treatment, about good medical care, about good counseling, that concept that Christianity is somehow in a different place to where that concept, when Jesus says, I am the way, the truth, and the life, that every good thing from the Father comes from above, that all truth is God's truth, right? And we can see that, in so many other areas, that good truth, that is a gift from God. And for us in this world, right, what I want to do is that I want to be the best doc. If I'm a good Christian guy that loves God and loves my family, and I'm a crappy doc, that's not good, right? I need to be up. I need to be giving them good advice and prescribing the right things. And if I've got a plumber come to my house and he's got a little Christian ichthus on his truck, I really want to know, are you a good plumber? Right? Because that's what I care about. I'd be great if you're a believer too, but I'd rather have a non-believer who's going to fix my house so it doesn't leak, right? But truth. So for us, right, what a great sort of responsibility and endeavor we have if we do indeed personally have that belief system in something bigger, for us to be the very best that we can be. And for me to be a part of La Hacienda, a part of All Saints now, just a Christ-based treatment outpatient program, to go, hey, if we're going to do this, I don't want this is not just a Bible study deal. Like I want true, deep hard counseling, dealing with real stuff and real things. And if they need a prescription for Prozac and to see a psychiatrist, they need to see that, right? I'm about prayer, and God can heal, and God can heal everything. But most of the time physically, most of the time God doesn't do that. Because if miracles happened every day, they'd be like normicals or something, right? I mean, like, and God's like, hey, I care about your heart. I care about your long term. I care about eternity, right? And so in that process, for me to just recognize, yeah, I'm gonna pray for my nephew struggling with addiction, but I also want him to go see a good counselor. And he's got bipolar 2 disorder, and I want him on a mood stabilizer, but I also want him in a Bible study, and I want to pray for that guy too. I want to do all of that, and all of those things are truth. So, hey, thanks everybody. Thanks for letting me be a part of your afternoon.